This week, not only a busy week preparing for the holiday, but also a busy week for our state legislators and lawmakers, as well, of course, as the country on a whole. Governor Josh Stein signing several bills Tuesday. We brought that to you here on Live Impact News, including, we talked about the PAVE Act for transit. That's for Mecklenburg County especially affected, but also the Omnibus bill. And this is really going to affect PAs in two measures. So with that sweeping health care reform bill that's promising to transform North Carolinians' medical care, that's really going to affect both urban and rural areas for practice. A major shift now specifically in how physician assistants practice medicine in North Carolina. So this morning in the Live Impact studio is PA Truett Smith to talk about these changes. Truett, thanks for joining us here this morning on a holiday. Appreciate you coming in.
Thank you for having me.
All right, so let me ask you this. Let's talk about a little bit before and after, get people caught up on what this bill means. What do the requirements include before the legislation, and then now what are we going to look to moving forward?
Yeah, so the bill will have an immediate impact on access to care in North Carolina, and the big changes will be it will reduce administrative burden to PAs, and so that administrative burden takes away our time to care for patients. It also will attract qualified PAs from the entire country to come to North Carolina to care for patients as well.
So why did the medical industry, require, adequate medical attention? Why did we need a change?
Well, the change is, so right now we spend a lot of time in doing paperwork, and it kind of removes a lot of that paperwork and just the time involved in completion of that.
What does this mean for telemedicine then, and not having to do so much paperwork?
Yeah, so part of the bill is a medical compact, and so currently there are 18 other states in the compact. I think we will be number 19, but you will be able to complete like one application and apply to multiple states. So in telemedicine, many of the providers who practice telemedicine practice throughout multiple states, and so it will actually really reduce their burden of completing applications in every state.
So that really, does that benefit then both patient and the medical industry, right, as far as
Absolutely.
PAs and care?
Yeah. Telemedicine really opens the doors to be able to treat, especially patients in rural areas or patients in urban areas. It's very convenient to see those providers.
Yeah, for sure. So what do patients need to know then?
So I think patients need to know that their PAs are qualified, and we're here to serve you, and so we're hoping to improve that.
Mm-hmm. Yeah. What do you think about as far as education goes, then PA programs, the education trying to get to a position where they can be moving forward?
Yeah, currently we have 12 PA schools in North Carolina.
Oh, okay.
Unfortunately, a lot of those PAs who graduate from those schools do go to other states that maybe have more modern law, and hopefully it'll keep those PAs here. And we really don't feel like the bill will impact the schools because they won't train any different than they're currently training.
Okay, all right. And so hopefully with something like this, is the workforce maybe strengthened then, trying to keep qualified PAs here in the Carolinas, or in North Carolina, I should say?
It absolutely should both attract PAs from outside of North Carolina, but also keep those here who train here.
All right. Anything else we need to know, Truett?
We're just happy that, I want to specifically thank the legislators who were involved in this bill. Mark Hollow, Senator Mark Hollow, he's actually a retired PA, and so
okay.
he was instrumental in getting this bill moving through the Senate and through the House, and I want to thank the governor as well for signing the bill.
All right. Truett Smith, a PA, talking about some of the changes that we could look towards with Governor Josh Stein signing this major bill, and how that is really going to reform medical attention and care in North Carolina. Appreciate your time and insight.
Thank you for having me.